Welcome to 2023, everyone. Really good time. Obviously, January, we're all motivated to make some health changes. And so, given that it's January, I'm going to reintroduce who I am, but also reintroduce what is functional medicine. So it's a question that many people are asking at the moment. So I'm Pete Williams. I'm the founder of Functional Medicine Associates. We are a group of IFM certified clinicians based in central London. And that question, what is functional medicine? Let me give you a little bit of information about that. I think before we do that, we may want to look at healthcare in general. And the way I look at healthcare is we've got two sides to it. We've got the acute side, the emergency medicine side, and we've got the chronic disease side. And they're two slightly different methods. So let's explore that before we go on. So, acute medicine, what's an example of that? Let's imagine that I've taken the dog out for a walk this afternoon and unfortunately I get hit by a car. I am going to need to be in an ambulance, taken straight to the hospital, to the emergency department for acute care emergency medicine of a traditional conventional medicine model. And in that situation, that is the absolutely best treatment that I can get from that. And that's great. And that's what we call, if you like, acute care medicine. That, to be fair, the NHS is probably the best place in the world for that. But there is another side of healthcare, isn't there, that we're all aware of, and that is chronic disease. And unfortunately, chronic disease is really epidemic these days. And that could be obesity, diabetes, rheumatoid arthritis, Alzheimer's, for just three examples of chronic diseases. And unfortunately, our model of healthcare, our conventional medicine healthcare model, isn't that great at dealing with these diseases. So why is that? Well, I think that's a really good question. And I think the question is because these chronic diseases are incredibly complex. And so it's not something where you can just give a pill for an ill. You've really got to look at this and understand the real complexity to something like a chronic disease such as obesity. And that's where I believe the sort of functional medicine healthcare model is incredibly helpful. So let's explore that, because what is functional medicine? For me, and again, when I'm trying to explain it to patients, it really is this science-based whole body, whole systems approach to looking at really some of the fundamental underlying causes that create not only clinical symptoms with our patients, but disease. And so you've got a healthcare model that helps a patient deal with the symptoms, really important, but it's really trying to look at all these multiple variables that may be at the root cause of why this person has the disease or the disorder. And so you're really looking at the root causes. You're going upstream to try and find what's causing them. And that might be inappropriate lifestyle. It might be their genetics. But the key really for functional medicine is you have to have that time frame, and you have to partner up with your patient over time to be able to explore those processes and those mechanisms and those underlying root causes. And that's just not something that we have the capacity to do with the conventional medicine model. So look, some of the things I think about with functional medicine is that as a clinician, I'm really interested in how and why an illness occurs in an individual. And my role is to really sort of restore their health, restore their functionality, if you like, by not only addressing symptoms, but really looking to sort of get to the root cause of those diseases for each individual. And I think this is a major point of functional medicine. And that point is each patient is completely unique. Why is that so important? Well, let me give you an example. Let's imagine two people come in and they're both diabetics. The treatment strategy, even though they've got the same chronic disease, is going to be completely unique because those people are unique. And I think that's one of the key mechanisms that sort of distinguishes functional medicine maybe away from a conventional medicine approach. That said, I think what is great that we're seeing, particularly in the NHS, is they're starting to recognize that personalization is the way we need to go, and they're actually looking at using gene testing, particularly in cancer care, which I think is a brilliant step forward for the NHS. Well done. Move into that personalised approach for each individual. So for me, again, functional medicine is not alternative medicine. It's not you use either or. I think what functional medicine does really well is it draws all the best information from conventional medicine, but it also takes on board the new findings, particularly from the point of view of systems biology. And it really is getting this understanding that, particularly with chronic disease, not acute care, there is a multitude of influences that may be influence an individual who has a chronic disease. And so my role and functional medicine role is to really sort of understanding those underlying causes of disease. For people, again, when they've got these chronic diseases, lifestyle will play a huge factor in that. Some people, again, don't eat well, they don't sleep well, they don't exercise well, they've got poor relationships, and they may be quite heavily predisposed from a genetic perspective. So what I believe for me, functional medicine gives me and gives the patient is a much more expanded treatment option than just a pill for an ill. It gives us a greater range of treatment strategies. And again, what we're starting to see now, even within sort of conventional medicine and even with very conventional and private medical institutions, is how functional medicine is coming in to be part of those institutions. Let me give you a couple of examples as well, because I think if you look to the Cleveland Clinic, in the US, a very big and prestigious private institution, they have a department of functional medicine, and they are actually producing some good science to show that actually functional medicine is creating better outcomes, health outcomes, than conventional medicine approaches. So I think what we're seeing in the scientific literature is more papers showing that functional medicine in certain circumstances is definitely the way to go. But I think also what's great is we're starting to see how functional medicine can become an adjunct process and treatment with conventional medicine. Let me give you an example of that. Here's a recent paper that was in PLOS One, and this again from the Cleveland Clinic 2020. What this paper is doing, it's entitled "The Impact of Functional Medicine on Patient-Reported Outcomes in Inflammatory Arthritis." They used two arms of this study. They took patients that had a conventional rheumatoid arthritis treatment, and they had another arm that had patients with a conventional rheumatoid arthritis treatment and a functional medicine approach with that. And of course, what did the outcomes show is that the patients with the conventional treatment and the functional medicine treatment that was adjunctive to that had better results. And I think this is absolutely something that we're going to find, because of course rheumatoid arthritis is a very complex condition, and you're going to get better results when you have a much bigger picture to look at. So not just from a perspective of giving people medication, you need to understand that patient who you're giving the medication to, treat the lifestyle, and have a better understanding of that patient. So again, as a clinician, where do I think the difference is? And again, what am I interested? I'm interested in what's happened to the patient to this point. How is this patient over time? And again, many chronic diseases take decades to develop. What's happened? What's their story to this point? And many people believe that, you know, what you see in front of you, that patient, is a combination of both genes and their experience, i.e. their book of life. What has happened to them over those years? How's their lifestyle been? You know, how have they looked after themselves? Again, you know, how good has their food been? How much exercise have they taken? All of these really allows us to understand why that patient is in the situation that they are sitting in front of us. And so it's really, really important for me with complex chronic diseases is we get that understanding of the patient's story. You know, what has brought that patient to that point, and how do we make the most of it? I think a couple of the other things, again, with regards to functional medicine, but I would also say this applies to every other aspect of healthcare, is that the patient has to be an active participant in the strategy and their journey to better health. Because if they're not, then what we're not going to see is as good results. And this is something absolutely we've seen over the years. Because, and what I say to our patients is that if we're having to do more work than you, then that might be problematic. So in any patient where you're trying to use a functional medicine model, or of course other models, they have to be ready for change, and they need to be the active participant with the clinician who is helping them. And look, so I believe that my training, all of our people are IFM certified, and they are IFM, they've had the gold standard of what we would consider functional medicine training worldwide. And I think what that's given us is a unique set of tools, if you like, a medical operating system that allows us to encompass the whole person. And what it also does, as obviously the more experience you get as a clinician, you develop a really good ability to create a strategy, both immediate, midterm and long term. And the reason why that's important, of course, is because chronic diseases in many of our patients are taking decades to get there. So you're not going to turn them around overnight. And for many of our patients, they may be with us for 2 years as we bring them on a journey back to health. But as a clinician, you get that experience about how to develop a roadmap for them, you know, how to develop a sort of instructions manual and a strategy that says, at this point in time, I need you to do this. And one of the key things about that is that you are, as a clinician, the person who comes onto the journey, comes onto the pathway at certain times to give them the instructions for them to go on to the next steps and next steps. But of course, as you say, it is the patient that needs to make those next steps. But I think one of the key things, again, for functional medicine is that you have the time. You have the time to consistently guide your patient through the process, because when there are lots and lots of things that that patient needs to do, they can get lost. So I think one of the key skills in functional medicine as a clinician is being able to give your patient almost on a daily basis, here's the things that I want you to do within this time frame. And so hopefully that is giving you a really good understanding of, you know, functional medicine and how it works. And again, we'd love to see you.